and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm joined by Jodie Simich. Welcome, Jodie. It's good to have you here today.
Hi, everyone. It's so exciting to be here as well. Thank you, Kristen.
Jodie is here for our Gold Neonatal Online Conference, and you have a very important topic titled Reducing the Risk of CLAB in the NICU, Strategies for Safe Central Line Use. We're going to talk about that in just a moment. But Jodie, tell us a little bit about yourself. First of all, where in the world are you?
I've actually recently moved to Brisbane, Australia, but previously I was living in New Zealand. That's where I trained and practiced for many, many years in neonatology.
In neonatology. Tell me a little bit about your background. You mentioned earlier before the recording, you said it's been 20 years or over 20 years. So tell us
I
a little
know.
bit about your work
Yeah.
and what you're passionate about.
Sure. Yeah. So little old me started in the Philippines, but I actually did train in New Zealand many, many years ago. As you've mentioned, Kristen, that's 20 years ago. The time has really flown by really quickly. But it's been great. So what started my career in neonatology was when I was actually having a placement in my nursing for my final year. And my little brother was admitted to the NICU. He was slightly preterm and was jaundice, had ABO incompatibility. Um, and I met one of the nurse practitioners who was actually looking after him and teaching one of the registrars or junior doctors. And I saw her, and that was it. I was
Wow.
hooked. And I said, this
Yeah.
is where I really want to work. And that's the career path that I really want to work on. So, I've been really, really fortunate to be able to go to work and do the thing I love. I find it a very, very, very rewarding job. And it's always great to go to work where you're happy, right? And feeling
Yes.
satisfied with it.
Absolutely. Well, thank you for sharing that story. I mean, what a beautiful background that inspired you to, you're seeing the care for your little brother there and that
Mm.
inspired you to go into that field and help other babies and families. Absolutely fabulous. So let's talk a bit about the topic.
Mhm.
For those less familiar, can you explain what central line associated bacteremia CLAB is and why it's particularly concerning in the NICU?
Okay. So, as the name suggested, it's pretty much an infection related to any central lines that we insert on babies. And
Mm-hmm.
obviously, for babies that, need to be in the NICU, a lot of them are born preterm, unable to feed straight away. So, we do
Right.
need to give them nutrition somehow. And one of I guess the procedures that we do is central line, and that's either a long line or an umbilical venous catheter. And this is really to help babies grow as we're trying to introduce feeding and to make
Mm-hmm.
sure that they tolerate feeds really well. But as you well know, Kristen, with any plastic that we
Yep.
introduce, there's always that risk of infection,
Mm-hmm.
particularly when you're not careful with handling, whether it's insertion or maintenance. Um, and so this is where infection comes in that's related to that central line alone. And we know from multiple studies and research that with any type of sepsis, it really does increase the morbidity and mortality of a lot of our neonates. And in fact, in terms of mortality, it can go up to as high as 40%. And this has
Okay.
a lot of impact not only on the neonates, but the family itself, because we know having a baby in the NICU is a very stressful time, and then you add in when they become really sick and they might end up a baby that will be intubated or needing
Mm-hmm.
antibiotics for a long time. So for me, it's been a passion that
Yeah.
that I've sort of started involved in 2015, and until now, it's really something that I really, really am very passionate about in wanting to promote it in different units and different staff that work in the NICU.
And you're very successful with implementation of what can be done. You're going to give your presentation there. So I can't wait to learn more about that. Tell us a little bit more about the unique challenges because neonatal population is, very unique, as you mentioned. And so the prevention of infection might be more difficult compared to older pediatric patients, right?
Yes, because we know that, especially our really preterm ones, in terms of their immunity, it's not fully developed.
Mhm.
They have comorbidities as well. And as I've mentioned before, because they're born preterm, they need long lines or central lines for nutrition. So that in itself is a challenge. From the insertion point of view, when they're
Mhm.
really tiny, that's technically it's very challenging as well. So it means that there might be multiple attempts or multiple manipulations that increases the risk of CLABSI. Um, a lot of our babies, particularly the sick ones, will need multiple infusions and medications. And again, if you're not careful with handling of the central line, there's always that increased risk of introducing infection. And then lastly, particularly if they're really unwell, they might need that long line for longer time. And we know
Mhm.
that the longer that central line is in situ, the higher the risk for CLAB, basically.
Right.
Yeah.
Yeah, absolutely. So ideally it would be the shorter line, but as you mentioned,
Mm,
they might need that longer line. So that's,
mm,
yeah, absolutely. You mentioned the parents, right? Like you mentioned how
mhm,
stressful it is also for the parents.
mm,
What are you doing with regards to education,
mhm,
involvement on the topic? Is there something involve them with, or talk to them about it, or
mhm,
educate them?
mm.
So how are the parents? What is the parents' role here in this scenario?
So obviously, before we do any central line insertion, we have to talk to the parents about it because we need to let them know and educate them the use of the central line and how important it is, but also the risk associated with it. But in saying that, when we do counsel parents, we talk about how carefully we manage these lines from insertion to maintenance, and the goal is always to remove it as soon as it's not needed. So there's that reassurance that we give them in terms of that. Reassure them of how we also handle the line. So we really
Mhm.
try and do it as cleanly as possible and protect key parts. So, and I'll talk about key parts in my presentation later on. Um, and then the other thing is that ongoing conversation, right? Because we know, as
Mhm.
I've mentioned before, it's very stressful time for them. And what they could do for their family is really, from their point of view, is maintaining good hand hygiene. We
Mhm.
know, and we've always been promoting hand hygiene I know in our unit, and I'm pretty sure elsewhere too, about how life-saving it is. And so maintaining that good hand hygiene, either through use of alcohol gel or hand washing, it's one little thing, and it's not actually little. They think it's little, but it's one thing they can do very well for their child while they're in the NICU.
And I can also think of, this could be like a little bit
Mm,
empowering for the parents,
mm,
right? That they feel like, oh, I can do something here,
mm,
I'm contributing in a positive way, making sure, I,
mm,
do that. And so that, stressful time is of course very stressful, but giving them little, not only the education and information, but also things they can do in that particular
mm,
time,
mm,
might be very good. So you've come a long way. You've been doing this since 2015, you've said, right? Like
mm-hmm.
working on this.
Yes,
Yeah, yeah,
yes.
it's you have some great successes. Where do you think it's going from here for the future? Is this like where you want to take this? Is there any, room for improvement, or do you want to, what is the next, what does it look
Yeah,
like for you?
yeah. Yeah, CLAB prevention, Kristen, is always a work in progress.
Uh-huh.
Um, because you'll probably see that there will be moments where we do really well, and then the next year we don't, and that's why
Mm.
part of CLAB prevention is really ongoing surveillance, and
Mhm.
from then on, and having good communication with staff so that it's always at the forefront of everything. The surveillance and auditing is really helpful because then we can figure out which part we need to improve, and we can keep doing that, and targeting that particularly around education of staff, whether it's nurses or doctors. This is everyone's concern.
Everyone's concerned. Great.
Mm,
And love that. Yeah. So it's an ongoing process.
yeah.
Never ends, of course.
Mm.
Before I let you go, Jody, what are you hoping our viewers will take away from this presentation, and any final words you want to have for our viewers here?
Sure. As I've mentioned before, CLAB is important because it does affect the morbidity and mortality and the hospital stay of a lot of our neonates. But the good news is, and I always tell everyone this, it's a preventable episode, right? There's strategies we can do to actually decrease the risk of CLAB. So hopefully, if there's one thing you can take away from my presentation is that you will learn about strategies and implement it hopefully in your unit so that you can improve your CLAB rates as well.
Thank you so very much, Jodie Simich. It was such a pleasure having you here, talking with you about the amazing and important work you do and your presentation here at Gold. Thank you so much.
Thank you, Kristen.
And now some information for our viewers. The presentation, Reducing the Risk of CLAB in the NICU, Strategies for Safe Central Line Use, is part of our Gold Neonatal Online Conference. That conference is just around the corner. June 3rd, we get started with our free keynote presentation. So make sure you join us, sign up for the free keynote, but also check out this wonderful presentation here and all the other presentations in the conference. So we invite you to go to goldneonatal.com for all the information. Thank you everyone for watching and have a lovely rest of your day wherever you are in the world. I hope to see everyone at the conference. Bye-bye.